Dr. Alan Cheung, and I'm a consultant orthopedic surgeon based in Singapore, and I specialize in robotic joint replacement and sports injuries. So osteoarthritis refers to wear and tear or degenerative change in joints. Essentially, it's when the smooth cartilage layer in the joint breaks down, wears away, and the joint becomes very stiff and painful. Perhaps it's more common now worldwide because people are living longer. Because the end of the day is that cartilage doesn't heal when we have a certain amount, a bit like a car tire. And when that car tire wears away, then sometimes the joint needs to be replaced, just like you replace a wheel. The factors which cause or are associated with osteoarthritis are firstly age. So if you live long enough, your joints will wear out. And that usually starts in our sort of early 50s. So the average age of someone having a joint replacement of their knee or hip is usually in their 60s, sometimes earlier. Other factors include genetics. So if you look at your parents and they have bad knees, unfortunately, you could also have bad knees, but at least you can be more aware of that and try and do things to prevent that or reduce the risk of osteoarthritis from happening. And the third major risk is sports people who've had an injury several years ago, perhaps neglected or ignored it, like a ligament tear in their knee, and gradually the joint wears out quicker over time, so they present at an earlier age with osteoarthritis. People who have severe osteoarthritis, say of the knee or hip, and they've tried all the non-surgical methods like physiotherapy, injections, and it hasn't helped, they may be a candidate for a joint replacement. So in the past, this was all done manually by hand and using the human eye. But nowadays we have more advanced robotic technology so that the surgeon like me can come along and plan very carefully to 0.1 of a millimeter or a degree how much tissue I'm going to take away and how to rotate the implant. So by using robotic technology and computers to help our surgery, it's a bit like trying to perform a complex equation. You can do it by hand on paper or with an abacus, but if you use a computer, then surely it would be more accurate and faster and get a better result in the long term. Patients have many misconceptions about surgery, that it's going to take a long time, that it's going to be extremely painful and take a long time to recover. But in the right patient, then it can be a very effective way of taking away what pain they have almost instantly, and the recovery can be pretty rapid. So I expect my patients who've had robotic surgery to be able to walk on the day of surgery. Some can walk without a stick by week 2, and many are working by 4 to 6 weeks if they work in an office. So I'm based in the Mount Elizabeth Hospital in Novena in Singapore, and it's basically an excellent facility. It's state-of-the-art. It's very clean, very safe. It's based in Singapore. It's easy to get to, and it has all the facilities and all the sort of most advanced technologies available to medicine currently, including robotics, which may not be available in your home country. I think that the expertise there is unparalleled. We have doctors like myself who've trained from all over the world, trained in the UK, US, Australia, who are based there, and it's hopefully a very pleasant experience for you and your family to come here to Singapore and get treated. Don't ignore your pain, because if you do, you may have just picked up an injury that will trouble you 20 years down the line. But you must get it checked out, at least see a physiotherapist or a sports doctor to get it checked out thoroughly. And for the older patient whose joints are wearing out, to get checked out regularly every year make sure things aren't deteriorating at a rapid pace. If you and your loved ones or friends have any sort of muscle, joint or bone pain, then please come and pay me a visit at the International Orthopedic Clinic in Mount Elizabeth, Novena Hospital in Singapore.